TMJ is temporal mandibular joint. And when the jaw is misaligned or the teeth are misaligned or there tends to be a joint problem, we will have pain in this area. When either chewing or opening or both, the joint can click. People can have headaches. Interestingly enough, there's a lot of symptoms that overlap with everyday symptoms. For me, I would be studying for an exam. After that exam, I'd have a splitting headache. It wasn't due to the fact that I was under too much stress from my exam. It was due to the fact that the stress was causing me to clench my teeth a certain way. Because my teeth were not lined up properly, it was causing the muscles to overact and the muscles to be resisted by the joint. So I'm going to exaggerate a little bit, but if you're moving your jaw this way all the time, you're stretching these muscles and using these muscles to pull the jaw this way. I use the example all the time. If you were walking on flat pavement in sneakers, you'll be fine to walk a long distance. Take your shoes off, put one dress shoe on, one barefoot, and now walk on pebbles. You're not stable, and that's going to be uncomfortable. If the teeth or the joint or even the alignment of the teeth don't match the movement of the joint, that results in some sort of pain. I've had patients come in with ringing in their ears. I've had patients come in with headaches. People have thought their migraines needed only medication. I had one patient, we ended up giving her a properly balanced night guard. And I asked her maybe about a month later, how were her migraines? And she said, I still have them. And so I was puzzled by it. And I said, well, how many migraines did you have prior to us making you this guard? And she said, I had one every day. And so I said, how many do you have now? She said, maybe like 1 or 2 a month. So maybe we didn't bring her to a level where she was completely cured, but maybe there is a dental correlation to her migraines, in which there was. So looking into that deeper, we can help further. There are cases where ringing in the ears, as I said, someone who was chewing, he had a lot of pain. He had gone to neurologists. He had gone to physicians. He was on quite a few medications. And it turned out that once we corrected his tooth positions and he was able to bite correctly, it did require quite a bit of work for him. But once we put his final restorations in, he bit down the first time and he said to me, I think there's one spot I need to adjust just a little bit. I adjusted that spot, he went, that's it, that's perfect. That was 5 years ago, and he has not been on any medication since. He is very wise about, he does wear his night guard, he does watch his relaxation and tries not to put himself in such a situation where he's under a lot of stress, which is easier said than done in New York, but he also understands the things that are going to trigger his troubles. But even with all his normal everyday life, he has not had an episode again. And it's mostly because of the fact that now his teeth are correct. They had worn down and he was compressed. The joint, as you wear down the teeth, the joint will move upward. And so if we really look at it, we'll compress the joint. So if we expand the teeth again, we're pulling the joint back into place. So now we have stability for him. I had one patient, which even all my mentors are still astounded by, who she was deaf in one of her ears. I believe it was her right ear. And she went to an ENT, she went to a neurologist, she had MRIs and CAT scans, and they said, you don't have a brain tumor, we're really not sure. She came in, we did an evaluation on her TMJ and realized it was out of joint. I put her on a special relaxation machine that we have to relax the muscles. It's called the TENS unit, transepithelial nerve stimulation. Relax the muscles. We ended up putting her in a special night guard. She ended up wearing it at first for 2 weeks, almost 24 hours a day. 4 days later, she called me and said, I don't know what to do. And I said, are you still having the hearing trouble? She said, no, I can hear now, but it's too loud. And so we realized that all of these years of her having the stuffy ear that turned into actually going deaf were the nerves themselves trying to amplify the sound, realizing that they were somehow muffled. We had her do a few things, but in about a week it had normalized and she has been fine ever since. So there are very interesting symptoms that would overlap into TMJ, that when the patient has gone to their neurologist and they've gone to their physician, they've had an MRI and they've had a CAT scan, they don't have a tumor. Then someone says, oh, well, either you have TMJ, and many times the ENT will figure that out and send the patient to us and say, I think the patient has TMJ. And they're correct, and we can help.